little hitch. We had a little technical problem here, which I guess is normal. It's the first time I'm having a technical problem on the show. So again, you are all warmly welcome to Let's Talk About Health, and we are live on Facebook and YouTube, and I hope you are all online watching us and waiting for us to start tonight's show. We had Mr. Charles Jaja here 2 weeks ago, and he gave us a true life experience with kidney failure, kidney disease, and he was backed by Madam Winifred Yeboah Asare, who gave us all the technical support we needed that day. The feedback that I had was amazing, and I've said tonight, I know a lot of you are really backing and almost like cheerleaders out there. So I'm acknowledging these people, and I'll keep doing that on every show. I have Lydia Kwashi, Archibalda Bedu, Matilda Moore, Charles Quist, Francisca Ameyao. They are with RAN Nurses Group. And I also have Kwenu Hazel, Efua Amen, Samuel Sabe, Mary Wilmot Badin, Naomi Lamte, Francis Amate Pio, and Francis Achampon. These people are always sharing my shows. So I say a very, very big thank you to you all. We are live, and we are bringing you this through omegalivetv, who gives us the platform to come your way with all the health professionals to give you all these very important health topics. Tonight we are well supported. We have more and more people showing interest and supporting the show, and we have Base Group that is supporting us, giving entrepreneurship training to the youth. So Base, thank you for coming on board. We have World Remedies. World Remedies was one of my first sponsors. They got on board last time we were here. You all know about World Remedies by now. Please use their services, safe and most efficient way to transfer money to your friends and family back home. And tonight, for the first time on this show, I have Wache joint. Wache is a delicacy, a Ghanaian delicacy, and there is this fantastic place in West Green Road, Seven Sisters, and they are also supporting the show. They are sponsoring us for the first time. And then I have Cosmetic Cocktails. Cosmetic Cocktails are also on board, and they are supporting me for the first time. So it's getting bigger, it's getting better, and I can only say thank you to you all. Mr. Jaja, I know you are watching because you were very keen to follow the show after you featured last time. We have all the time in the world, and as you know, at some point I'll be inviting you to come on board with all the questions that you have. I have a very beautiful guest with me tonight, and you can all almost tell what she does for a living just by watching her smile. So, beautiful lady, I am always thrilled when I see young people, young African people, taking on very, very fantastic roles and progressing with their career. So I am so pleased to have you here. Can you tell us your name and what you do, please?
Thank you so much for inviting me to the show. So my name is Dr. Toyin, and I'm a dentist working in London with a special interest in cosmetic dentistry. So for me, I love dentistry. I'm very passionate about what I do, and I'm on a mission to get our community more engaged in taking care of their oral health.
Wow.
Yes.
Wow. I think that is very, very necessary, because I am sure so many people are watching, because we are not really into it when it comes to oral health or dental health. Why is it such a challenge for people to look after their teeth?
I think people have really disconnected from the idea of seeing the dentist, especially regularly. So some people may see the dentist when they've tried to do everything at home to avoid coming to the dentist when they're in pain. And I think part of the culture is you don't go to see a doctor unless there's a problem. So the same goes with dentists. You don't go to see the dentist unless you have no choice. But that's not really the way it should be. We should be going every 6 months for our checkups. And
every 6 months?
Ideally, yes.
Okay.
Yes. So if everything is really, really good, it might be prolonged to 9 months or 12 months. But ideally, we say on average 6 months for your checkups.
Oh, well, then I think a lot of us have a problem, because I don't even remember the last time I went to the dentist, and that is why I am so excited to have you here. So again, you are warmly welcome.
Thank
Obviously, you did mention in your intro that it's a cultural thing. By cultural thing, I guess you mean as Africans. Is it African Black ethnic minority groups? Is that what you mean by that?
Yes, I would say in particular within the African community. I can speak about our community because I understand the culture behind it, but even there are a lot of countries, people that have come from countries and they've emigrated here, and it's the same pattern that you see in different communities, whether it's the Indian community, the African community, there's similarities. But the main pattern is people do not attend regularly. They attend where there's a problem, and the main thing is people try and avoid at any cost coming.
Every excuse to avoid the dentist.
Home remedies are what people go for. Anything to avoid coming to see us. Yes.
Yeah, I'm probably the same. So what sort of home remedies do you know people tend to resort to?
So we have people that are in pain with a particular tooth, they may try and put aspirin at the side of the tooth, or they use cloves. That's a common thing. I know that there's different types of concoctions that people use to rinse with to try and settle pain. Warm salt water is very common as well.
Okay.
But you do hear stories of people shaving down their own teeth and doing drastic things to avoid coming to see the dentist.
Anything to avoid coming to see the dentist. So I guess there must be a good reason why we must come and see the dentist. Why are we supposed to come that frequently to see a dentist?
So ideally, as I said, every 6 months you come for the checkups. The main thing is we want to establish a regular pattern of coming, so that at every checkup, when we're screening for certain conditions, those conditions are picked up early. So the most common things that we check for are tooth decay. And tooth decay does not necessarily tell you that it's creeping up unless it's a very significant amount of decay. You won't necessarily get pain from it, and that's why people tend to come to the dentist when the pain is unbearable. By that point, let's say the tooth is really broken down, and what tends to happen is people now come at the point where in so much pain, and the only treatment option is to have the tooth removed. So the whole idea of seeing the dentist regularly allows you to really catch things early and prevent you needing lots of extensive treatment. But the other things that we're looking for are signs of gum disease, whether it's bleeding gums, bad breath, gums that are really red and swollen. All these things are what we check for. And yes, you can try and maintain good oral hygiene at home, but there's only so much you can do without the help of a dentist.
Right.
And then we're also checking for signs of wear. Have your teeth broken?
Wear and tear.
Yes, yes. And the most important thing that we're actually screening for is oral cancer, so mouth cancer. And mouth cancer, it's not very obvious to catch to the untrained eye. So sometimes it can present as just a red mark in the mouth. It may be look like an ulcer. And so things that appear normal can actually be what we call sinister. So when you come regularly, we can pick up these things, and it just means that you don't want to ever get to the point of seeing the dentist when things are too late. So this is why I was really excited to come onto the show today and talk about things like this. Thank you.
Well done. Yeah, I know you were really up for it because you have a message for the people, and that is the culture I'm trying to develop. Get all our health professionals to come and share the knowledge that you have. Because like we had, you listened into the show we had 2 weeks ago, a patient's account of what they have been going through with illness, with disease, and how they have really controlled themselves and stuck to the rules, studied their body, so that they have lived that long, all because they know what to do, what not to do. So if we don't have these consultations, obviously, if we don't share our knowledge as health professionals, how will people know? That a little ulcer in your mouth is meant to be the beginning of something sinister like cancer of the mouth.
Yes.
So how you've already stated that we have to do 6 monthly checks, or yearly checks at least at the minimum, isn't it? So
Yes.
what I know that gum disease and all the oral health stuff could be an indication of other serious illnesses going on. Can you tell us about some of the things that can actually be an indication of other conditions going on in your body?
Okay, so there are quite a few different conditions that you'll see the first sign in the mouth. And so we say that the mouth is the gateway to the rest of the body. And when something is wrong in the body, somehow your body will tell you.
Yeah.
So the things that we look for in the mouth that might be a sign that something isn't quite right, it actually tends to be what we would say is ulcers. But with ulcers, they can present for different reasons. So let's say, for example, you're looking after yourself, you're eating right, and you're getting recurrent ulcers. That might be a sign that actually there's an underlying systemic condition. Maybe you're lacking particular vitamins. It could be a sign that you actually have a gastrointestinal condition. It could be Crohn's, for example.
Really?
And yeah, so these... The ulcers, for example, present in a number of conditions relating to the digestive tract, and they tend to occur often. And then you have conditions such as thrush in the mouth, and that tends to be a real key sign for when we're looking for
oral thrush.
Yes, yes. So it will appear as these white spots. Sometimes you'll try and clean these white spots off the tongue and the cheek, and they stay. In most cases, it could just be that, let's say somebody's wearing a denture, or they actually might be using an asthma pump. With the asthma pump, what happens is regularly...
Just the asthma?
The inhaler.
The inhaler.
Yes. Even that can cause thrush. So we always advise patients, when you finish with the inhaler, you're to rinse afterwards.
Okay.
Otherwise, you're prone to getting this thrush. And with the thrush, it can be quite stubborn, very painful as well.
Obviously, considering how common asthma is as a condition. So, yeah. So what are they meant to do exactly, like for asthma sufferers using inhalers?
So they will use their inhalers as has been advised by the doctor. But what they should be doing afterwards is rinsing their mouth. It just helps to cleanse the mouth of anything afterwards, and it should be every time you finish with the inhaler, you rinse afterwards. That should be the general routine. Because sometimes I might see a patient and they're saying, I don't know where this has come from. If they're quite young especially, I would ask, are you using an inhaler, and what's the routine regarding it? So thrush, not only with asthma or someone who wears dentures and they're not looking after the dentures, but even patients that have immunosuppressive, so patients that are taking steroids regularly, you find that they tend to be more prone to thrush, for example.
Yeah. I think it's worth knowing, it's very important people know as well, that when these ulcers start coming, they are quite regular. They can be on and off, and that is more of an indication of other serious things happening elsewhere, isn't it?
Yes,
they don't tend to come in isolation and go away, sort of, isn't it?
Well, sometimes it depends on the person. So there are some people out there that they have ulcers and there's absolutely nothing wrong with them. They only get ulcers when they're stressed.
Okay.
So we'll even talk a bit more about stress, because that has there's so many signs in the mouth of someone that's stressed. But with the ulcers, it can vary. It can definitely vary. So that's why when you go regularly, you might think this is, normal, and it comes and goes, and so you're not concerned, but it might be a key sign that there is something that is underlying going on.
You see, I'm doing this because of especially the use of medication, home remedies, things that people use all the time and take it for granted. So you did mention aspirin as some of the treatments they use to soothe the mouth or to get rid of these ulcers. How bad is it to be doing that?
People that are particularly anxious, they're the ones that tend to go to any length to avoid seeing a dentist, and it tends to be if they've had a bad experience before. Some people, the reason for going to the dentist, it may just be the culture of, I can manage it at home, so why bother going? But some people are afraid as well. So with the home management, there's various reasons for it. Some people might just do the management because they want to try and improve their smile at home with measures they've seen online.
But can they actually use aspirin? Really?
You shouldn't be using it in that way. You shouldn't, because what will end up happening is the lining of your mouth will start to peel away, and it can burn, and that can take some time to heal and make the situation just worse.
Because the thing is, aspirin has got anticoagulant properties, isn't it? And I know that from a cardiac point of view, when they give them aspirin as part of treatments for heart attack, and it just sort of breaks down clots and stuff like that. But if people are using these, it can be potentially very dangerous. And what it means is that it will be thinning your blood as well. And so the continuous use of aspirin and such remedies can be very, very dangerous. And these are the things that I want to come out of a show like this, so that they are practical. You don't use aspirin. People who use aspirin are monitored. You know, they have underlying conditions that they need to be having aspirin, and they can have the aspirin. They are monitored by their doctors, monitored by their general practitioners. So aspirin is a no-go area. I am a big fan of, you know, not using too many medications, because you don't know what your underlying conditions are and how badly these things can affect you. So what are the consequences of poor oral health then?
Well, poor oral health can affect you in a number of ways. To start off with, if you're someone that is generally not happy about the appearance of your teeth, and you're not going to the dentist, you're not accessing help, because things can be done to improve your smile. And what tends to happen is someone that's self-conscious about their smile, they may end up having low self-esteem, and they may not interact or be as confident as they can out there. Other things are, they may, when you're not going regularly, you are more likely to end up with dental pain. That dental pain will affect your sleep. You'll end up being less productive at work. And then there's also the fact that by the time you go late to see the dentist, what will happen is you'll end up incurring more costs, because something that could have been dealt with very small and simple will end up now being something that requires multiple visits, and then you will be at the point where you're like, dentists are expensive, because it would be when you end up going when there's a lot to do. But if you go regularly, every 6 months, that's when things just tend to be straightforward. You're just going for your checkup and clean, and that's it. That's the aim.
I think at the end of the day, we'll probably change a few minds and get some of us to go to the dentist, because it's not something that we do regularly enough. If you have just joined us, we are live on Facebook and live on YouTube through Omega Live Multimedia, and they are our main sponsors for the show. But for tonight, we also have other sponsors on board. We have Bays, we have Cosmetic Cocktails, we have World Remit, safe and most efficient way of sending money to your friends and family. Tonight we've been looking at dental health. If you haven't joined in yet, please do, because these little information that we share, it could be life-saving, you know, and things could be caught up really early to save someone's life. So I always say, share it, keep sharing, keep liking our page. I want you to start watch parties, do whatever you like to bring your friends and family on board, so that they can share in this fantastic information that we are coming out with. So yes, we have been looking at the consequences of not visiting enough. Are there any other consequences then of not seeing your dentist enough?
Those tend to be the main ones, but what I've noticed also is that when you don't go regularly, then there's more of a chance of developing dental anxiety. Now with the dental anxiety, it is fear, that's the cause of it, but it can really limit some people. So there's dental anxiety, and when it's extreme to the point where you're no longer thinking rationally about the measures that you take, you avoid seeing the dentist at absolutely any cost, then we call it dental phobia. So with the anxiety,
that's probably what most of us are suffering with, you know.
but then to also admit that you're afraid is part of the issue, because it's that culture of I'll leave it, or it's not important. But really the fear of being vulnerable in an environment such as a dental practice might be the reason why people aren't going, and that can now escalate. So when you finally come to see us, because you're not a regular visitor, you're on edge, you're uncomfortable, and then you know your heart rate is going, your mouth is dry, and you're sweating, and
you are suddenly falling ill.
And then because there isn't that relationship that's been built previously with the dentist, you don't enjoy the experience. It becomes very uncomfortable, and that's when people end up saying, I hate the dentist and I won't be back.
Yeah. Okay, you know, as Africans, we have this practice of chewing bones. Bone chewing is like we can't finish our meal without chewing bones. Obviously, we've been told from time back that it will be giving you a lot of calcium, so we really go for it till the bones are really ground smooth. You can actually paste your face with it. How good or bad is this practice?
So this is a particular topic close to my heart
because
I see the damage it does. I know this will upset some people, but the truth is it does a lot more damage than the proposed good of getting the calcium.
Really?
Because I almost describe it as taking a hammer and chipping at your teeth, because the amount of force that the chewing and the biting does, what it does is it wears away the teeth over time. And often I'll have a patient come in and there's a broken tooth, and the tooth is let's say split down the middle, and the only option is for the tooth to be taken out.
All from chewing bones?
Yeah, I see it so often. And then
really?
And it tends to be people from our community. So I'll just be thinking, should I ask, have they been chewing bone? And the answer is always yes. And we now have to have a conversation as to why not to. But the problem with it is that the damage it does is not repairable. So
really?
Yes.
How bad can it damage your?
It can literally split. You'll be biting. You say, unless you say you have one side that you chew on more, you will bite on that side, and it tends to be the back tooth. So when you bite on it, the force, it just causes the tooth to split in the middle, and sometimes the tooth will even separate, and the patient will know that the tooth is moving in the mouth. And when it gets to that point, there's nothing that can be done to save it. So the only option is to remove, extraction. So the tooth is removed. And then you now have to think, I'm missing a tooth there's a gap, and that now opens a can of worms, where I always say prevention is key. So I know that there are people that are actually addicted to it.
Yeah,
because it's something that you're so used to from young.
Does it actually really give us any calcium at all? We do need calcium, but is it really a source?
Honestly, you don't. There is enough calcium in our diet, and if there are some patients that they do have low calcium, but then it can be prescribed, but generally not enough, because of the amount of risk that it does. It is not worth it.
It's not worth it.
No, I've seen the catastrophic damage it can do.
Yeah. Oh, right.
And the same with actually opening bottles.
Yeah.
Supermilk bottles.
Yeah. Using our teeth as what fruit juice openers and bottle. That one I can tell straight away is bad. The bone bit is going to be a bit of a problem though. we have to adjust, but obviously it's not worth it doing that.
It's not. But it's something over time you train yourself to reduce it. But I'm hoping that the image of the tooth being hit with a hammer, that's what's happening over time. I guess sometimes you have people where they bite, they open the bottle and they know that the tooth is broken straight away. But with the chewing bone, it tends to be more of a gradual damage. Yes.
Yeah. So by the time you become aware of it, it's causing you major problems.
Exactly.
No bone chewing, my people. Yeah, that will take some getting used to, not chewing bones, but we have to try. Definitely. Because obviously the risks outweigh the benefits, if there is any benefit at all.
Exactly.
So we do have enough calcium through our diet, not to be worrying about finishing our bones off and all that. Okay, we will do our best. I'm sure we will try. Right. So a lot of the main reason people hardly go to the dentist, I believe, is the cost of getting to the dentist as well. How much they will pay. So especially for those of us who live here in the UK and in other developed countries, can you just give us an idea? What is the cost like? How expensive or not is going to see a dentist?
Okay, so in this country we have access to the NHS, and it is a blessing. But within NHS dentistry, you're actually paying for treatment. Private dentistry, that's where you're paying for everything, and it's per item. But everyone can access NHS dentistry, but you will still be paying for the treatment, and there are some people that they fall into the bracket where they are exempt and they don't actually have to pay. So I always,
which people are these people that are exempt?
so it tends to be children under 18, or if you're 19 and in full-time education, you don't pay.
Right.
And pregnant ladies, the moment that you have your proof of pregnancy, you can officially start receiving your free NHS care, and that lasts for a whole year after the baby has been born.
All right. So that would be a good time to see a dentist, isn't it? Oh,
Get
I should have done that. It's a bit late for me now. Right. Okay.
And then there's a particular group of people, let's say they're on certain working tax credit, universal credit, they may be eligible for NHS exemption for dentistry. But some people think that, okay, by the time they retire, that's when they'll access free dentistry. That is not the case. There are 90-year-olds still paying for NHS dentistry.
Because they can afford it.
No.
What's the reason for that then?
Everybody pays for NHS dentistry unless there is a particular reason that you're exempt. So there's a form that you can ask any dental practice for you to fill. And that form, you just ask them about NHS dentistry exemption, and you fill the details. So it tends to be people with some form of working tax credit. And there's other criteria, but when you fill in the form, then you'll know that you're eligible for NHS exemption. One thing I would say is, if you're not 100% sure, wait, complete the form and hear back from the people, because what will happen is people... Is
the form online? Is it an online form?
No, you get it from the dental practice. So you can just go into...
Any?
Well, before COVID, you could walk into a practice and just ask for the form, you fill it, and then you can just simply wait to hear from them, and they'll tell you that you're eligible for it. But if you now say that you're exempt, within the dental practice, nobody will actually check, but it's the government that will now check. And if you're found to say that you're exempt and you're not, they'll fine you. So it's really important to get the form, HC2 form, and when you get that form, you do the checks, and then you know for certain.
Wow. So for the person who doesn't qualify for this kind of treatment, like free on the NHS, how much cost are we talking about? I'm sure it depends on the kind of treatment that they will be having, but averagely for a routine check, for instance, because obviously if we make it a culture of visiting the dentist regularly, then we can curb some of these problems that we can have in the future on the average, because maybe I'll come after this. How much cost are we talking about here in the UK? Because obviously I have people watching from everywhere, all over.
Okay, so with the general checkup, that is including your full mouth examination and x-rays, and sometimes cleaning as well. So that is £22.70. So if you think about it, £22.70 every 6 months, that's less than £50 a year for your general checks. And let's say you do need treatment, if it's a filling or let's say a root canal treatment, those things are under the second group of treatment, what we call band 2 NHS treatment, and the cost of that at the moment is £62.70. And the advantage of this is that under the NHS, you're not paying per tooth that needs treatment. You pay one charge.
You pay per tooth?
You don't pay per tooth. So let's say you've come in, you've had your checkup, and now you've been told that you need 3 fillings. Under the NHS, even if you was having 1 filling, it would still be that band 2 charge of £62. So with the NHS, there is real value for money if you need lots of treatment. And then we move on to the third group of treatment, which is band 3. This is where you have treatment that may involve a crown or dentures or a bridge, anything that is requiring the input of a dental lab. So the cost of that is about £269 at the moment. So if you're coming regularly, the aim is that you stay within the first band of treatment, £22.10, so £22.70 for your checkup and your clean. Right. If you come early, you might just need 1 small filling, and that's your £62.10. Maybe you have 1 filling in a few years. And going on from that, as long as you're coming regularly, you're more likely to need the £62.10 treatment than the £269. So it's just a case of playing it smart. You come regularly, things are picked up early, and sometimes when decay is actually caught early, it doesn't necessarily need treatment. In the very early stages of tooth decay, there is potential for the tooth to actually heal itself. And so when you have your dental x-rays, we can point out the areas that are going to need to be monitored. And their hope is that when we monitor it and you know which areas to focus your cleaning on, that area of tooth decay can heal. But that's only in the very early stages. But what happens is people come a lot later, and by that time the decay is close to the nerve of the tooth, and that's when you get that raging toothache that keeps you up at night.
My experience with tooth problems of any sort is when I see my poor patients going to have assessments for any kind of cardiac procedure, and they come with go with a full mouth and come with all their tooth taken out. Which I guess is a very, very serious thing to experience. But what happens in that situation? What is going on? Why do they have to have all the teeth taken out for cardiac procedures?
So we term that in the dental world as a dental clearance.
A dental clearance.
So quite a routine thing where you have patients that, like you said, the cardiology patients, before any major operation, what we would do is assess to see, okay, which teeth need to come out. That's if you're lucky. If it's an urgent procedure, there is a chance that you might just have to have all the teeth taken out. Because what we don't want is for there to be teeth that are bad or are very unkept, that potentially contain bacteria, and that bacteria can spread into the bloodstream and cause problems. So when it seems so extreme, but
it is extreme.
It is.
I've seen it happen, and it's the most scary thing that could ever happen to anyone. Very, very scary experience, but it's necessary.
Definitely necessary, because let's say for example with the cardiology patient, we're hoping to prevent endocarditis, so infection of the lining of the heart, and that transpires when the bacteria from the teeth in the mouth can get into the bloodstream and directly affect the lining of the heart. So with the condition like that affects the heart, and you're already trying to recover from a surgery, what you don't want is to now end up with a major life-threatening infection. So in our minds, we're trying to prevent anything that could potentially take life. And so the cost of that is losing the teeth. And with losing the teeth, that in itself now presents a new set of problems and adjustments for the patient.
Okay, so at the moment a lot of people are watching, and I have to acknowledge their presence on here. But I seem to be having technical issues as well with this, because I don't seem to be seeing too many of them. But I know Charles Quest, Eva Newlove, Princess Fusua is watching, and she says the fee ranges from £22.70 to, is it 263? That's what you said, isn't it? Is she someone you know? Is she a dentist? Because obviously you must.
She might be a dentist. She might be a dental nurse.
And Charles Quist is saying candidiasis is the most common oral opportunistic infection affecting people with HIV infection or AIDS. It is also considered as an important marker of immune suppression. I think we said that earlier, and may be the initial manifestation of the disease in about 10% of HIV infected adults. He is a nurse, so I know where he's coming from. And routine costs have been mentioned, and Princess Fusua is again highlighting how much it can cost. Mansa Maroon, white fillings cost an arm and a leg, much better than the black filling. However, I'm not sure whether that is a question or not. And AC Hammond is also watching. She happens to be my big sister. Mansa Maroon, I did hear heart health is linked to dental teeth, and I think we have looked at that as well. Sedgrave Samson is also watching. For some reason, I can hardly see many people on here, but I know there are 52 people live now who are like live online, but I can hardly see them on here. So I think I'll wait for my technical team to look into that. So, and with all of this, and the fact that we ethnic people, minorities, have such problem, what advice can we give then? Obviously, you've said about visiting the dentist quite regularly, isn't it?
Yes.
Which is key. Is there anything else we need to be doing or we need to know?
Yes, I've actually brought some stuff that I can show in terms of how to clean properly, brushing, using floss, and all those things. Because especially if you want to prevent conditions, it's about taking control at home and maintaining good oral hygiene. But one thing I did want to touch on actually earlier is just the fact that medications are really, really important, and a number of medications have side effects that actually can cause dry mouth, and that in itself, dry mouth can be very uncomfortable and can lead to potentially decay and bad breath. So the reason why I mention that is because you need to, you not knowing, going to the dentist regularly, you might be taking medication and not actually know what impact it has on your mouth, and you might be complaining and noticing some things but not realize
medication, prescribed medication.
Yes, a lot. Medications for hypertension, for depression. Actually, most medications, if you read the back of it, the side effect is dry mouth. And so I just wanted to touch on that because there are things that you can do at home to help.
Oh, but I think these are the tidbits we need, really. Yes. So what do we do then? Because in this case, these are prescribed medications people need to take. It's not like off-the-counter stuff people have actually acquired by themselves, and they are still having these kind of side effects.
Yes.
Right. So what do we do in that case then?
So with the dry mouth, for example, we'll initially say, okay, try and take regular sips of water, but sometimes the medication can be strong and you can't affect it. It can even affect the saliva glands, and so the flow of saliva coming out is really reduced. In those cases, you can look at purchasing some medication.
Moistening.
Yes, exactly. And that will just help lubricate the mouth and make things more comfortable. We can also tell you about things such as certain sweets, lozenges that you can use to generate or increase the flow of saliva. But there's so many different medications out there with that side effect, and people really struggle. But sometimes even seeing a dentist with that is important, because when the mouth is that dry, you're more prone to decay. And again, you can try and manage that at home, but it can be so severe that we now have to prescribe you a special toothpaste to help prevent the risk of decay.
Oh, right. Wow. Okay, so we have more and more people joining us now. I'm sure I saw your family on another screen. They were all in here. They say, oh, go girl. Yeah, your family are watching too. And I have Christian Ohenikisi, that's my husband. He says, is it true that poor oral hygiene in men could lead to erectile dysfunction? What is the link?
To be fair, I've not come across that one, but what I can say, poor oral health, no, I'm not sure about that one, to be honest. It's not something that we've come across.
We only go by evidence-based, stuff.
Yes.
Who taught you that? Okay. Right. So you haven't come across that yet.
Well, it's not anything that's been there's evidence to back that. I
mean, I can only relate these things to general stuff. Like we said, the mouth is the opening, the entry to our body and everything. So, and we did mention about how there's so much bacteria in the plaque that is built up as well. So you never know. It could just simply be because your whole system is run down, and then once your system is taken over, your immune system is broken down. Obviously, from a cardiac point of view and from a whole lot of views, I do know that once your immune system is run down, it can cause other problems, systemic problems. So, you never know. Just let's look after our mouth. And that's why we are doing this. Right, and William Kisi, who is my daughter too, is saying, are there any cosmetic dental procedures available on the NHS or subsidized by the NHS? I think I do quite see where she's coming from, especially if people with cardiac conditions are going to have all their teeth taken out. is there any help in that case, for instance, more so in that case?
So with the patients that are having to have dental clearances, often they are assessed in the dental hospital. And when they're assessed in the hospital, they're more likely to receive full care that will involve the assessment, removal of the teeth. But afterwards, with the number of teeth that are removed, they will now have to provide a replacement. To be honest, sometimes because of the limitations of the NHS, even within the hospital setting, it may be a case of you're being referred back to your dentist and you're now having to pay for something like dentures at that $269 cost. But let's say, for example, patients that have cancer anywhere in the head and the neck regions, even up to the thyroid cancer, you will be treated at the hospital, the dental hospital, for your care. You're more likely to, in those cases, have dental implants funded under the NHS. Other reasons why you might have implants or treatment under the NHS that could be deemed as cosmetic is if you have a significant medical condition where you were born with missing teeth. So in those cases,
can you explain that a bit further? Because I don't think any baby is born with missing teeth. How?
Yeah, so we call it hypodontia, where let's say you have most of your teeth, but up to 8 teeth in the mouth at one time may be missing. As you grow older, we're looking where are the adult teeth, and those adult teeth do not come through. So naturally you have gaps where these teeth should be. So with that condition, it's something that you're born with, and in that case we can offer options where you can have the treatment to replace those teeth at the hospital. So it could be implants, it could just be false teeth that are stuck in place. But those are the cosmetic looking treatment that you could have at the hospital as well.
Right. Yeah, I think it's getting more and more exciting. I can tell how people are eager to ask all their questions. Just so you know, this all came to you by kind courtesy of Omega Live Multimedia, Cosmetic Cocktails, World Remit, Base, and Wache Joint. I like that one. I hope there's some Wache waiting for me after the show. Not just me, for all of us, really. Yeah. But yeah, just to say we are very grateful for your support. I think I did mention World Remit as well. I'm very, very grateful. I can see more and more people are coming on board to help the show to go on, because trust me, I believe a lot of our health professionals will love to come on a show like this to share their experiences with us. So yeah, thank you very much. Let me see who is on here. Terence in Krabia, do you know this person? He's saying the best recommendation is to visit the dentist every 6 months and change the toothbrush every 3 months. I think you are going to show us how to even brush our teeth properly, isn't it?
Yes.
And Mr. Charles Jaja, who was my kind guest, Mr. Jaja, love you so much. He says it was my pleasure because I did acknowledge him. Pleased to know you find it very useful. Mr. Jaja, you have no idea how useful the information you gave was, and to be honest, people are asking for you to come back. He did kidney failure because your story is not finished yet, so I am definitely getting you back here. So you come and fill in all the gaps that people want to know from you. So thank you for watching. Nelly Kodo, AC Hammond says it was incredible. That's Mr. Jaja's show. Adelaide Amaboni Ouswachem, Odukoya Risika, you know this person? Odukoya, I think. Doctor, God bless you. I think they really know you. Andrew Chumesi is watching. He's a pharmacist. He says anti-muscarinic side effects like dry mouth can be caused by medication like Buscopan, Amitriptyline, and Piriton. So please take note, viewers. Buscopan, that's for abdominal pain. Amitriptyline is usually used as an antidepressant. Usually used for antidepressive kind of conditions. And Piriton, usually used for hay fever as hay fever remedies. No wonder my mouth feels a bit dry because I use that sometimes. Just so you know, and these are the little things. You know what I advise is whatever medication people are taking, take time to study the medication and know what and why you are taking it for, and why and how long you can even have it for. Ask your professionals and they will tell you about it. Nana Sarah Amufa is saying, are there dental instruments that can push teeth forward? Are there dental instruments that can push teeth forward? And another person is asking, how safe, Asiamond is asking, how safe is it to use toothpicks? Are they safe to use at all?
So with the first question, I'm not sure she means that, is there something, are there treatments that we can do to push teeth forward?
Yeah.
Or does she mean that it's more of a consequence of us doing treatment? I'm not quite clear.
No, I think because this person actually told me about this as a personal thing.
Okay.
She says most people, when they smile, you can see their teeth straight away. But when she smiles, it's like she really has to go for it to see. So is that, like how we have those kind of metal bridges, or that treatment to close gaps and stuff like that. Is there anything that can bring the teeth forward to make them prominent, like sort of?
Well, there are things that can be done to straighten the teeth and to move the position of the teeth, to bring them forward, to make teeth that are twisted straight. And so there is what we call braces, and there's different types of braces. There's metal braces that you normally see children with, but now things are moving forward, and dentistry is quite exciting now. So there's Invisalign, where you can have clear braces to move the teeth into the right position. So sometimes it's a combination of you move the teeth, you now design the shape of the teeth so the teeth look fuller, and that might give you a more appealing smile. But sometimes it could be a case that when you're smiling, your lips are very low, and so the smile isn't completely showing. With that one, there are different things that can be done. Some people are now actually having Botox on their lips, so that maybe a smile that was really gummy before, and you see all the whole mouth, but the Botox will now relax it and do the opposite and hide the smile. So there are definitely lots of different options available, but it sounds like teeth straightening is what she'd want, and that could be Invisalign.
Yeah. And I'm sure this person called Princess Fusua is probably one of your colleagues. Yeah, because the kind of information she's putting on here, I can tell she knows, she's got the idea of dental health. And she's saying if someone has such problems, they should see an orthodontist as well.
Yes.
Yeah. Is that something, is that part of your specialty, like general dentistry, or?
So nowadays, you're finding that a lot of general dentists like myself, we are now exploring doing more teeth straightening, and that tends to be through systems such as Invisalign, or there's so many different ones out there, but those tend to be more straightforward cases. When you have a very difficult case or complex bite, or you want to go to people that are trained to only deal with teeth straightening day in and day out, that's when you go to the orthodontist, and you can either see an orthodontist through the NHS. So children that have very severe bites that are very complicated, they will meet the NHS criteria for the orthodontics. But adults and children that is just more cosmetic, then they can still see the orthodontist, but privately.
Yeah. So many people are asking about chewing sponges and chewing sticks. You know, the African kind of traditional chewing sticks and all that. But people generally have to be careful, isn't it?
Yes. So with the chewing stick, that's quite good in terms of its antibacterial. It contains antibacterial agents, so that motion scrubs the teeth, but it can do a lot of damage because it can be quite abrasive. And just remembered the question about the toothpicks. I do not recommend toothpicks for daily use to clean the teeth. I mean, fair enough if you're using it just to remove something out of the mouth. Let's say you've got some meat between your teeth, but there are specific instruments or tools that you can buy in the supermarket, in the chemist, that are designed to clean in between the teeth. Those are, you can either use floss. I use floss every day, because even I notice when I don't use floss, it just doesn't feel as fresh in my mouth. So I always say for every patient, you should be flossing twice a day, but at least once a day as part of your cleaning routine.
Probably the technique of doing it, and you are going to show us how to even brush our teeth properly, isn't it? Yeah. In the Yankee, Vanessa Abaka Michaels says, yes, Dr. Toyin, you probably know this person. He says, keep going, girl. Eva is your friend who actually introduced me to you, isn't it? And a presenter here at Omega Live TV. Eva, well done, and thank you so much. We are really having fun and learning so much as well. Ty Jones, my dentist, do you know him?
Yes.
I can always tell when the people know the resource people. Beatrice Ado is watching. She lives in Cambridge. Beatrice, thanks for watching. Kwabna Akono says, deep inside, Kenny, Ayegbisi must be your relative. Is it, Kenny?
Yes, I'm sure that's my mom.
Is it? Well done. She says, well done. Yeah, thanks, Mom. Margaret Dankwa is watching, and Tammy Bless. You know Tammy Bless? Anyway, Genesis Brand is asking a question, and it says, why is the UK really expensive, especially when you want to achieve the perfect smile? A lot of people travel as far as Turkey to get them done, as it's affordable in these places. I have found it really expensive here. Why is that the case? And I remember seeing Vienna. She is in Cambridge as well, and she was talking about having like dental insurance policies and plans like that. So I will look for the exact thing that she has mentioned, and I'll let you know. But Mansa Maroon is saying, how about using a water irrigation pick to clean between the tooth? Is this a safe option? Water. Yes. What exactly is that?
So water pick is almost like a small. It has a small nozzle, and there's a bottle attached to it. And with that, the water is inside, and it's like a small water jet, and it blasts water in between the teeth. But it's been designed so the amount of force that it does it with is not too...
It's gentle.
Yeah, so it will remove the debris in between the teeth, but without damaging it.
That is a safe option.
Yeah, that's a good alternative.
And is this something that we can readily obtain?
Yes, yeah. So when you're the same area that you'd get electric toothbrush from, or online, you can easily get one of those. So water pick, Philips. So Philips have a good brand of that if anyone's interested.
Yeah. Okay. So all we are saying is there are better remedies other than some of our primitive ways of doing things. And so hopefully you are picking all this up, and we'll go by the recommendations from our specialist. Tonight we have been listening to Dr. Toyin Ayubisi.
Yes.
Yes. Did I say it well?
You did.
I tried. Yeah, and it's been fantastic so far. We are getting to the latter stages of the presentation, and I always say, share, like. I keep saying that do this because that's the only way we can get other people to learn about all these stuff. And I'll be keeping an eye on all of you who have been sharing and liking and supporting this program and acknowledging your inputs every single week I come here. So as I said, I am very grateful to all that you are doing for supporting us. Nana Abaka Adai is watching, and he says, oh, I know him. He's a church member, actually. He says, yes, it's quite expensive to get whitening done in the UK. What's the cost? Because I think a lot of the viewers are asking about this. How much does it cost to whiten your teeth?
So with the tooth whitening, the price can vary depending on where you go. For example, where I'm working, we charge £300 for the whitening. I always say with tooth whitening in particular, you have to see it as an investment into your smile, into yourself. And you can go to, I'm so glad that, I can't remember the name, but that they've touched on going to Turkey for treatment.
Right.
People always tend to feel that treatment in the UK is expensive.
Yeah.
When you compare it to other countries. Number one, the reason why the cost of treatment here is quite expensive is because the equipment that we use, the materials are quite expensive as well, and so that is reflected in the cost of the treatment. But also, I can't speak for other countries, but I mean, for example, Turkey, we have so many people that go and they come back and they're now having problems because it's less regulated. Here, we have the General Dental Council that are so strict and regulating us to the point where dentists are stressed because of it. But the great thing about that is the system is so well regulated. If there's any complaints that a patient has, you just go and it's sorted. So these are the things that make the dentistry expensive here, and also the expertise that you're getting. But let's say, for example, with tooth whitening, I say it's an investment in your smile. The difference it makes is remarkable. You get your compliments, and you can go and try and find tooth whitening online. You won't get results that last. So when you see the dentist, you are having, there's 2 different types of whitening, but the main aim is to lighten the shade of the color of the teeth. And you can either have home whitening, where you come to see the dentist, you have custom made trays. Those trays are given to you along with the tooth whitening gel, and over a period of up to 2 weeks, every night you wear those trays, or even during the day, and that will gradually whiten your teeth. And when you've had the whitening done, you keep the trays, and you can always just purchase more gel to boost the color. So it's a worthwhile investment.
Be shown what to do, isn't it?
Absolutely.
The right things to do. So
Absolutely.
It's the aftercare, I believe, which is more important, isn't it? How you can maintain your white, sparkling teeth.
Yes.
And I did say I wasn't going to smile today because, I mean, like, when I look at your teeth, it's a living testimony of what you do. It's beautiful.
Thank you.
Yeah, I will need to get my teeth like that, surely. So tonight I'm like smiling in like, because I don't want my teeth to be showing. Yours is so nice. Yeah.
Thank you.
So anyway, Ty Jones says, my dentist, Beatrice Ado. I did mention these people earlier on. Tammy Bless. How can kids get rid of plaque in their teeth? You know, yeah, that's a very good question. So think of answering that. Let me acknowledge a few more people. Fumilayo Adelaju is watching. Helena Kote, Jane Sirifi, Angela Nana Otu, Daniela Pritchard is saying, do you recommend charcoal toothpaste in the shops, whether they are good? So think about that as well. George Atiako, Sylvia Ugbamitete. Hi, Sylvia. Thanks for tuning in, Angela. Sometimes it just scrolls up so slowly. Stephen Tofor, Omega World. So thanks, Stephen. They are all watching. Dr. Sapia, what causes sensitive teeth and any treatment and prevention? I think we probably touched on that earlier, isn't it? Yeah, but if you can look at just these few questions for us, that will be fantastic. In children, like, why is plaque so common, and do we use charcoal toothpaste? And the last question from Docas, which says, what causes sensitive tooth, which I believe we touched on earlier on. Yeah. So
with the children and the plaque, sometimes it's just a case of the child isn't brushing properly. So with children, they should actually be supervised for brushing up until the age of 7. And that's because, number one, children can swallow too much toothpaste, and the toothpaste contains fluoride, and if a child has too much fluoride in their system, it will affect the development of their adult teeth, and they can end up with white or brown marks called fluorosis. So it's really important to make sure that you're supervising children brushing. But what tends to happen when you have a child that's brushing, maybe even up teenagers can do it as well, where they're brushing, not paying attention, and it's just a quick few seconds and they're done, they're out the bathroom. Or some children, they'll run the tap and pretend they're brushing and they're not. And what tends to happen is there's a build-up of the plaque because they're not brushing properly. And even if they're brushing properly, it needs to be for the full 2 minutes. So one tip I say for that is, if the child isn't engaged when brushing, play a song, because the song is going to last at least 2 minutes. And so the child must continue brushing until that time is up, so that all the surfaces are cleaned. It tends to be also when the adult teeth are coming through and the child is losing baby teeth, you can get food settling in the teeth that are wobbly, and that can give a really bad odor. So when teeth are very, very loose, I always say try and encourage the child to wobble the teeth themselves. If it's uncomfortable or giving a bad smell, that's if what is very loose, because it just needs a bit of help, a bit of encouragement, and it will come out loose quite quickly. But what you don't want is where the mouth is not well kept and there's a lot of plaque and bacteria. That can cause pain and the gums can become inflamed, and this is just a child, but it's just prevention again.
I think, and what about the charcoal?
Charcoal. So there's actually been studies into this, because the charcoal tooth whiten, when that came about a few years ago, it was just generating so much interest because it seemed like almost like a natural way to whiten the teeth. But the thing about what the evidence shows is that it's not more effective at whitening the teeth. What happens is you're brushing with a potentially abrasive product that then wears away the layers of the enamel. And the study showed, number one, it doesn't whiten the teeth anymore, but it can actually be doing more harm than good. Yeah. So for me, I recommend to stay away from charcoal whitening toothpaste. If you want to have your teeth whitened, even simple things that you can do at home can help improve the appearance of the teeth, and that will be better. Yeah. But with tooth whitening, invest in your smile and see the dentist and do it safely. You will have to
sponsor my teeth though, I tell you. Anyway, so Andy Chumesi is asking, how often do we really have to brush our teeth? It's the simple thing that we fail at, isn't it? How often, really?
So twice a day. I know there's a lot of people that only brush once a day, morning and night, and for 2 minutes. The reason why it's in particular important to brush at night is when you go to sleep, there's less saliva in the mouth. And so if you're someone that's eaten all day and then you now don't brush at night, the bacteria that's there settling in your mouth is more likely to cause decay and just build up again more plaque. But really you want to be cleaning twice a day to remove everything that's been built up throughout the day. And then you again brush in the morning. Yeah,
Damilola is saying her teeth are beautiful. Oh, they really are. It even looks better in person. Trust me, it's amazing. Yeah, so anyway, that is good. There is a very important question here from Ty Jones. He says, I once had a filling done after I had an accident and my front teeth chipped. However, when I was eating my pounded yam, I was with cow foot. I think he was eating pounded yam with cow foot, as in struggling with it. Is it important to refill the filling? I think the filling that he had originally has chipped off. Is it important to refill the filling, or can it cause a problem in the future?
So with front teeth that have chipped, I would say that, number one, from a cosmetic point of view, you want to have it filled because it's a simple procedure to build up the tooth to look very natural again with the filling. Yeah. If you choose to leave it, not filled, that is technically okay, unless it's a very, very big break that's happened to the tooth. When a tooth, let's say it breaks halfway on the front tooth, there's a potential for it to expose the inner layer of the tooth, which is more sensitive, so you can end up with discomfort. And if it's a really significant break, it can actually expose the nerve of the tooth, and that's when you get severe pain or infection. But in terms of the treatment, it can be very straightforward. That's if it doesn't involve the nerve. If it does, then you're looking at root canal treatment before you have the filling. Yeah. So I would like you to get ready and show us just the basic, even how to look after it on a daily basis, isn't it? Yes. How we can brush our teeth. But I think I did mention about the use of aspirin, and somebody was drawing I probably mentioned that it was an anticoagulant, but it actually has antiplatelet properties, as in aspirin stops like blood cells from clotting, sticking together. And Mawena Chikizak highlighted that to me. So Mawena, thank you. I think that's very important. If I just say it's got anticoagulant kind of property, but it's more like antiplatelets. Terence Nkrabia is saying, hello dentist and host, are toothpaste that contain fluoride good to use in brushing the teeth? Did you mention that earlier? Yeah, so you get ready with that. Vivian Opon is watching as well, and Margaret Dakwa, I already mentioned about Temi Bless. A whole host of people. Peter Mensah is watching. Yeah, thank you all for tuning in and watching. So get ready. Doctor is going to show us how to brush our teeth properly. And Doctor, do you have dental? Oh, you do have dental floss as well, yes, isn't it? How to do it properly. So I hope you will all stay focused and see how we are meant to do it Yes.
Yeah, okay. Yeah, so I think you can go for it now if you're ready.
Okay, so we should be brushing twice a day, and I bought a manual toothbrush today, but I prefer and always recommend an electric toothbrush.
So not just a preference, but a recommendation.
Yes.
Yeah, and why is that?
The electric toothbrush, it's spinning at a lot faster rate than you can move this brush, and the electric toothbrush will remove a lot more plaque for you. And so the technique is different. I will show you with the manual toothbrush what you can be doing, and you'll see that actually it's easier to use an electric toothbrush.
Yeah.
And so I always say just keep it simple. You get a good electric toothbrush, you invest in it, and you will even feel the difference. Your teeth will feel cleaner because the plaque has been removed at a much better rate.
Right. Okay.
So here we have a manual toothbrush. So the main thing is that when you're brushing, you want to not only clean the teeth, but the gums as well. And so sometimes, especially children, what they do is they brush the teeth and they miss the gums. And what will happen is normally plaque settles on the gum line. And so what you want to do is when you're brushing, you get the base of the brush to be touching right at the bottom of the teeth. When you do that, what will happen is you're cleaning the teeth and the gums at the same time. So if you're brushing too high up, you're cleaning the teeth, but you'll miss down there,
the base.
and that's why you can be prone to gum disease. One reason, if the plaque settles there, the gums are more likely to bleed and to become inflamed.
Yeah.
And so by you just engaging the brush at the neck of the tooth, that will get the brush in the right area. So with a manual toothbrush, what we recommend is going round in circles. You can angle it so it's tipping into the brush. We say a 45-degree angle, but just tilt it so it's not like this, but tilted, and then you brush round in circles.
And even with the choice of the toothbrush, is there any specific kind of toothbrush? Because we like everything. We like the rough.
I'm so glad you mentioned that.
Yeah.
Those I remember these bright orange smokers toothbrush from Nigeria. They are so damaging.
They are scrubbing brushes.
Yeah. You don't need to use a brush that hard, because you're just damaging the gum. What will happen, even with you have to brush rounds and circles, because what most people do is this. And what you do is you're scrubbing away the gum, and over time that gum will start to shrink down and the root of the tooth will become exposed. Yeah. Sometimes you can end up with sensitivity where all of a sudden you're feeling like you're getting cold from your teeth when drinking. Something even hot, sometimes it can be sensitive, or even on a cold day the wind is blowing and your teeth are sensitive because the neck of the tooth is now exposed. So with the hard brush, imagine how quickly you can just start scrubbing away at a soft surface. The gum isn't that strong. So that's why I don't recommend anything more than I say a medium brush is good. Okay. And the smaller the head, the better, because when you use a small head, it means that you're really taking your time to get to each tooth. This looks
really small. Is it?
Really?
Yeah. Is it like, I would say like this, without this session, I would say this is like a kid's toothbrush. Is it meant to be like for adults? Well,
to be fair, this is a special care toothbrush. But so the bristles are soft, but a normal toothbrush is a similar size head actually. And what you find nowadays is on toothbrushes, there's ridges, and that ridge can be, those ridges, you can use it to clean the back of your tongue. But the size of this is actually reasonable. You don't want something too large. So even with the electric toothbrush, the head is about half this size. It's like a small circle. And the technique for electric toothbrush is just holding it along the gum line. And when you do that, the electric toothbrush head will spin so fast and it would really clean the tooth for you. So just a few seconds on each tooth. So with the manual, you're going round in circles. The electric toothbrush does the job for you. You just hold it there for a few seconds. So that's the difference. And electric toothbrush, you will spend longer brushing as well because it's small. You will now get to each surface. It's really important to get all the surfaces. So the sides, the biting surface, the inside, and when we get to the lower front area, this is where we tend to, this area here, we get the yellow build up, the yellow tartar. And with that, you get it more there because the saliva pools in this area. So when you lift up your tongue, saliva naturally settles in this area. And what happens is, if you're not cleaning regularly, that plaque, which is soft, becomes hard. I describe it as human limescale because there's nothing you can do at home to just easily remove it. That's when we now say start seeing the dentist for cleaning, or the hygienist to remove that tartar, that limescale that's built up.
Yeah.
So with the brushing, you can brush vertically if you're finding it quite difficult to get to this area effectively. It depends on how your teeth are positioned. But you want to clean all the surfaces, and then you move on to flossing.
So in total, how many minutes are we looking at, especially for using a manual toothbrush and say an electric one, for instance?
So at least 2 minutes. With the electric one, advantage is that it has
total?
a time. Yes.
Okay.
The electric, with the manual, you might find that you do a bit longer if you want to be thorough.
Right.
But the timer will go off, and you'll know when it's been 2 minutes. Really, you want to spend enough time on each area. And then another advantage of the electric toothbrushes, a lot of them now have pressure sensors. So when you're brushing too hard, it flashes or vibrates. And so you have a monitor, you have something to
check.
It's so important.
Okay.
Because it's so easy to just brush too hard without knowing. So
I see.
I will move on to the floss.
The floss.
So with floss, you should be using it as often as you brush, but at least once a day. I recommend this brand because some of the floss.
What brand is it?
So this is Oral-B satin tape.
Okay. Yeah,
When
you can just show it so we project onto it. Yeah. Oral-B. Right. And why is that? Why is that so good as against the others?
It does have a lovely minty taste to it, which helps. But the main reason is because the fact that it's satin means that when you're putting it through the teeth, it's less likely to break. Some of the floss can be quite cheap or thick, or you find that it just breaks and gets stuck in your teeth. And that's when people say, oh, I've tried flossing and it hurts. It might be that you're using a floss that is quite abrasive and it's not really cleaning the teeth effectively. So I recommend this brand. With it, what you're doing, you're going to take about this much. So let's say approximating 10 inches. And what you do is you wrap it around your fingers to the point where you have enough control over it. So when you've got a good grip on it, you're now going to try and form a C shape around each tooth. So what you want to do is, rather than going up and down like this and cutting the gum, you're going to hug each tooth and form a C by each side of the tooth.
All right. Okay.
And when you do that, you clean right in between the teeth down to underneath the gum.
Yeah.
So same, you see each surface. So in between two teeth, you're going to clean one side, and then you move on to the other side. And then ideally what you want to do, especially at the back if you have fillings, is pull it through. Some people, they go up and down into the back teeth, and then they can sometimes loosen their fillings that way. So you want to be forming a C around each tooth, and then you pull it through. That's the ideal way of doing it. And you do that around each tooth.
And you use the same
you can use the same floss. But what you can do is, if it starts to get a bit damaged or it's just not fresh anymore, just move further down, or you can just get more floss. And I didn't actually bring these brushes with me, but there's something called TP brushes, and they are T-E-P-E. So TP brushes, or they're also known as interdental sticks or interdental brushes, and they are the ones that are similar to toothpicks. So they have bristles on them, and what you do, so just thinking how I can best describe it, it tends to be about this length, so about a couple of inches, and you hold it like a small pen, and you literally push it in between each teeth as you would a toothpick, but it does a lot less damage because they are designed to clean out in between the teeth. And these TP brushes or interdental brushes actually come in different sizes depending on the size of the gap. So with the toothpick, what you end up doing is pushing, especially in small gaps. You may be making the gap wider and damaging the gum at the same time. So I don't recommend that. Keep a packet of floss in your bag or some TP brushes. go to the bathroom, get rid of the meat, and you're good to go.
Yeah. I mean, viewers, if you've just joined me or if you've been with us from the beginning, that's the stuff that you will pay a lot of money for if you should go to a dentist to have. So share, keep sharing, keep liking our page, and let's get more sponsors in so we can get all our health professionals to come and help us to get the required knowledge for just the simple activities of daily living, isn't it?
Yes.
Yeah, because I'm sure a lot of us are not doing things right. So what about this equipment that we have here?
So,
what is that?
This is a tongue scraper. To be fair, you don't have to get one of these. I thought it's quite an interesting design. Let me bring it along. And what you do with it is you literally scrape it along the surface of your tongue, starting from the back forward. And it's designed to clean off any coating that has settled on the tongue. So some people brush the teeth well and they miss the back of their tongue, and that coating can actually cause bad breath if it's not cleaned off effectively. So,
but can we use the toothbrush to brush our tongue as well?
You can do. I always recommend, like I said earlier, there's toothbrushes that will have lines at the back of it, and on the packet it will say tongue cleaning. What you're going to do, let's pretend the back of my hand is the tongue. You just brush and that will clean off the coating. I would say that using the same brush that you clean your teeth with on the tongue, you can do it, but me personally, I have a separate brush. I have my electric toothbrush, and then I now have a brush with the ridges at the back that I use for my tongue.
Right.
So there's lots of different ways around it. You might choose to get one of these off Amazon or wherever, and they are designed to just simply clean off the tongue, and they say that they have antibacterial agents in them to help keep the tongue.
What? In this?
Yeah, the material, the way it's been designed is to maintain the cleanliness of the tongue going forward. So there's different things that you can use, but it's more having a system that you stick to regularly. And the thing about flossing is it's so essential. When you're brushing, even if you're brushing meticulously for 5 minutes, you will not be able to get in between the teeth. And that's where the plaques tend to settle, and that's where gum disease starts to form. So you want to be flossing or using these TP interdental brushes to clean out in between the teeth. When you do that, you're removing any plaque. Your teeth can look brighter because you don't have those yellow chunks in between them. Yeah. But also, that's how you're going to prevent gum disease.
Yeah. So, I think I'll check with our producer how much more time we have, because I know you do other stuff as well, isn't it? Apart from just being a dentist, you do so many other interesting stuff as well. So let's see who else is joining in. And I think Vienno Tega is saying TP or interdental brushes are an absolute must-have, like you said. Thanks for mentioning it, Dr. Tony. Vivian, you didn't tell me this. You should have done. I would have known this. So that's very good information to know. So yeah, it's been great. So just checking with our producer how much time we've got. We've got about 10 minutes. So I mean, tell us. Like when I started the show, I said, I know you are probably British by now, as in by living here in the UK. Yeah, but where are you from, and how did you get yourself this far? Because I'm sure you are a young, beautiful woman, and you've progressed so quickly. How did you come by all this? What did you do to get this far?
So I was actually born in Nigeria, and we came here when I was 5. And so I've been pretty much in the British education system. Yeah. For me, I didn't automatically fall into dentistry. I didn't, some people, they've always wanted to be a doctor or something like that. It was recommended to me. Yeah. I actually was really, really, really passionate about maths, so I wasn't thinking healthcare originally. But I did the work experience and I fell in love with the idea of being creative and also helping people in a very practical, caring way. So I did the work experience and then I decided, okay, I'm going to do dentistry. And
is it after medical school? Or?
No, so when I did my A-levels here, so at that point you choose your subjects that will align to a medical degree or dental degree. So I chose my A levels, I prepared, I did work experience and all of that. And then you make your applications, you write a personal statement. So when I did that, I was actually very successful, and I got 3 out of 4 offers for dental schools.
Oh, wow. Wonderful.
So that was very encouraging for me, because I didn't know any dentists at all. And I was the first doctor in the family, so it was really just a very strange.
Well done.
Thank you. But I was very determined that this is what I want to do, and I just did everything I could in terms of experience to get to that point. So I went through dental school. That was not without its challenges. That in itself is a whole show.
Yeah, I can imagine.
So thank God I got through dental school. And since then, I decided very on that I wanted to establish a very strong foundation in dentistry and really have strong clinical skills. So I worked in different hospitals around the country, doing pretty much every dental specialty there is out there, dealing with cancer patients, dealing with special care patients, really medically compromised patients. I've done a lot, and I'm grateful for that, because it's really opened my eyes to how much we can change people's lives with dentistry. It's something that's so often ignored, but the power to help people get healthy and to change their self-confidence and how they see themselves through simply smiling. I really do love what I do. And following on from that, doing the hospital training, I now went back to London, and I was working in the practice where I first did my training. And I was actually very fortunate enough to have a Ghanaian doctor as the owner of the dentist as the owner of the practice, and he was my first
here in London.
Yes.
Okay.
He was my first mentor, and it was funny because I went through a national recruitment process, and at the time I just thought, oh, this practice is near where I live. I'll put it as my first choice, and I got it. And that has been the best thing that happened to me in dentistry, because seeing a Ghanaian older dentist as a mentor, it really opened my eyes to the fact that I can do whatever I choose to, that is possible in this country. And he always used to say to me that you'll go far, and I've held on to that. And I've really taken on some really interesting opportunities, and now I'm really interested in cosmetic dentistry.
Cosmetic dentistry?
Yeah.
What is that about, cosmetic?
So cosmetic dentistry is where you're opting or going for treatment that isn't necessarily to improve the function of your teeth. So it's not necessarily about chewing better, getting out of pain. It's about enhancing your smile through different types of treatment, whether it be tooth whitening, building up and designing the smile so the teeth are shaped differently. There's so many different things out there, and for me, it's really interesting. And I think now everybody is more gauged to look at dentists differently because of social media. So that is even changing the way people think about their smiles. Now, if you look you'll see people with white teeth that are nicely shaped. It's not just in America anymore. It's coming to the UK.
Close to home.
So now you're seeing that people will be asking about all sorts of dental treatment. I want my teeth whitened. I want them to look straight.
Yeah,
it's
a lot of
becoming
people
the norm.
are asking that actually.
Yes. So now I think the way I am, it works very well to be able to get people out of pain, to transform smiles. And for me, having experiences of lacking confidence or being anxious, you now being able to help other people and to get them feeling confident about their smile, it's very rewarding.
It is very rewarding. Yeah, I totally agree with you on that. And I always try and ask people, do you ever have plans of going back home to, say, Nigeria to help out, if you get the opportunity? Because for me, I'm a big fan of that. Yeah, it's Ghana all the way. you know? Yeah, going back home, and you've come over here, you've taken your time to learn all of this. At some stage, it will be beautiful, isn't it, to go home, whether permanently or temporarily, to be engaged in any activity that will help our people. But I guess with this program, we are starting from here in London, and that is why I appreciate you so much for coming with your time and the effort and you were so passionate about it. So that makes me love you even more for coming. So yeah, we are just about to round off. Is there anything else you want our viewers to know? And viewers, I would say this has come to you by kind courtesy of Omega Live Multimedia, and we have been well supported by BASE. BASE is an entrepreneurship training opportunity that is offered here in London, and I'm sure our producer will give more information on BASE. They've come in to sponsor us. World Remit, safe and most efficient way of sending money to your friends and family back home. We have Cosmetic Cocktails, and they are joining in for the first time as well on this show to help us. And then we have Wache Joints. Surely I must get some Wache tonight. Do you know what Wache is, by the way? You do? Wache Joint. Between me and you, we probably have to do Ghana Jollof versus Nigeria Jollof. Oh, never mind. We won't touch into that. But Dr. Toyin, it's been a fantastic experience. I'm sure we can do this again, take another topic and do this again. But I cannot thank you enough, because these are practical things that we want to know, isn't it? We want our people to know. We want to share this. So keep sharing, keep liking, do watch parties, do anything you can to get so many people watching. The last time we were here, we got managed to get about 4,000 plus people watching the show about 2 weeks ago. And even for that program, you can keep sharing to your friends and family all over, so they get that kind of knowledge. And tonight has been awesome, Dr. Toyin. So I am so grateful that you came. So if you want to round off, maybe summarize, and then how do people get in touch with you if they need to get in touch with you? If you can tell us that as well, that will be fantastic. Yeah.
Again, thank you so much for the opportunity to be able to share a little bit about what I'm passionate about. And I've decided actually through this, especially during COVID, it made me really come to terms with the fact that I need to be doing more outside of where I'm working to help our communities to just break barriers to dental access. Stuff like this, where we're talking and just discussing questions, it really opens the doors for people to feel comfortable about seeking help for dental treatment. And so one thing I did decide to do is set up a social media campaign. And so I'm on Facebook and Instagram as Dr. Toyin Smiles, where...
say that again so they get the people are already asking for your clinic address, you see, so that's very important. Yeah, so if you go that, what's the address again?
So I'm based in London, in Bexley Heath, and the best way to get in contact with me is either via Instagram or Facebook. Just message me directly at Dr. Toyin Smiles. And with that, you will also find weekly videos that I post talking about different dental topics, such as toothbrushing, home remedies for tooth whitening, lots of different topics where I just share a little bit of insight into these topics. And so that's what I do weekly. So that's a great way of you keeping up to date and informed about the dental things out there. But
they have seen you now, so I'm sure they can identify with it even more,
exactly.
Isn't it? Yeah.
And I am taking on new patients, so it's just a case of messaging me. We can have a conversation beforehand.
So through that email address, and then we can get in touch with you, is it? Okay.
So the email address would be info@drtoyinsmiles.com.
Right, info
at drtoyinsmiles.com.
Yeah, obviously when we finish this, I think I can share all the necessary information on my Facebook page, so people can see it, and I'll forward it to you so you can also share and keep sharing, liking, posting, whatever you do, and be gentle on me when I send it to you twice. Don't chop my head off. I'm still learning this new trade, Yeah, so somebody's asking a very good question, and I think we'll round off with that. How safe are the use of all those mouth washes? AC boy ASL is asking, are they safe to use, mouth washes?
So mouth washes are good to use, but not at the same time as brushing. So when you brush, in fact, I'll even add a little bit more. When you brush, you're not meant to rinse out after brushing. The reason why
Go over that again. When you
So
brush.
when you brush for the full 2 minutes, you should not rinse out afterwards. And the reason for this is that the fluoride in the toothpaste, you want it to be in the mouth working for as long as possible. So when you rinse out after brushing, you're washing away the benefits of what's in the toothpaste. And so it's the same reason why you shouldn't use mouthwash straight after brushing, because some mouthwashes do contain fluoride, but it's less than that in toothpaste. So when you now brush with enough fluoride in there, you use the mouthwash with less fluoride, you're just washing away the goodness there. So the best thing to do is, yes, you can use mouthwash. Ideally, you want to use a fluoride mouthwash. Just look at the back of the bottle. It should say how much fluoride is in there. What you want to do is just rinse after lunchtime, for example. Use it at a separate time to brushing, and that's how you're going to get the benefit of it. There are mouthwashes that are designed to help bleeding gums, such as Corsadil, which is really popular. I'd say be careful with that, because if you use it for more than about 10 days, it can make the teeth appear brown and discolored. And also, I always say that with something like Corsadil mouthwash, you're having bleeding gums. You want to understand why you have bleeding gums. So go to the dentist. Exactly. It's a sign that something is going on. So before, you might have bleeding gums because you're stressed for a few days, or when you're pregnant, your gums bleed more. But what you want to do is, if it's persistent for more than 2 weeks, go and see your dentist. You probably need some gum cleaning just to settle the gums back down. But don't be using Corsadil as a measure that is, used all the time. You need to deal with the root cause of the problem.
So for a normal day, brushing first thing in the morning, late in the night, and then about how many mouthwashes in between?
I'd say you can do it once. Keep it in your bag or locker at work and just rinse after lunch, for example. That's a good way of doing it. Or let's say you come back from work and you just want to rinse with the mouthwash, you can do it then. But even mouthwash is not absolutely essential. The things that are essential are the brushing and the flossing. Those are more important.
Wow. It's been incredible. Viewers, thanks so much, all of you who joined in online. If I've not mentioned your name, next time I will definitely acknowledge you. I will be going and actually checking to see who has been liking and sharing and doing all the necessary things to help this show pick up even more and more views. It's absolutely important, and I might take this opportunity to say thank you to Dr. Toyin. I'll let you say this.
Toyin Ayebisi.
For taking your time to come. You see, you've been an inspiration to so many of our youth out there in terms of how many years actually did it take you to do all this training?
So it's 5 years to qualify as a dentist. So similar to medicine. And then you can look at doing hospital training or working in general practice. There's a lot of different options out there now.
Different options. There are options in every way you look at it. So thank you once again. I think it's been awesome.
Thank you.
You see, it's been so good. And
you've really enjoyed it. Thank you.
I have totally and thoroughly enjoyed you coming to share this with us. Hopefully we will do this again, maybe look at other conditions into detail. That's quite, especially the cosmetic side of things. I will share her details on my page and on her page as well, so people can keep in touch. And you never know, next time I come, my teeth may be just like sparkling like hers. We'll see, we'll look into all of that. But once again, a very, very big thank you to all those who gave us feedback on the very last show. I promise you, Mr. Jaja is going to come back to take your questions. It's going to be solely like a question and answer time, so he can go through all your questions that we couldn't catch on the last time. But today we have been looking into oral health and how best we can practice safely, on a daily basis in looking after our oral health. Your mouth is the entry into your whole body. So anything that is not going right in there can eventually cause you problems systemically. And that is the reason why this topic was so dear to my heart, because actually as a nurse practicing for so many years, but my knowledge in dentistry was like not good. Not good, because I don't think it's part of the general curricula, not in the days when I trained anyway. So I had a huge knowledge deficit there, but trust me, I have thoroughly enjoyed the show, and it's been awesome as well. So I'm sure people will keep watching and upgrading, you know, all their skills in looking after their teeth. When we come back in 2 weeks time, we are going to have a pharmacist with us, maybe a couple of them, community pharmacists. We will have Mr. Andy Chumesi with us here. He's based in London, and he is going to take time to look at all the kind of services you can have from pharmacists, as against, you know, like going to see your doctor. So that should be a very good one, and we will try and look at the effects of some of the medications we've been using on our lives and on our daily practices and stuff, and the importance of having all your medications reviewed. That promises to be another very good one. I can tell already, even post-COVID, that our viewing is going up, so please keep sharing. And this has come to you by kind courtesy of Omega Life Multimedia, Wild Remit, Base, Cosmetic Cocktails, and Wache Joint, which is at Seven Sisters here in London. It's been an awesome time. I'll say COVID is still here. We didn't really touch on that, but you know, if something doesn't feel right, it's probably not right. So please look after yourselves, and remember, for those of us who are in the UK, and I suppose in Ghana, we cannot visit shops without wearing a mask these days. It's all about your safety. It's all about your protection. Please look after yourself, and like I always say, work hard as if all depends on you, and pray hard as if all depends on God. And that's me there, right there for you. I love you all. Take care. And let me take this opportunity also to say happy birthday, belated though, to my very big sister, Issy Hammond, for your wonderful celebration. I'm grateful.